There are rarely answers for miscarriage, but now scientists have developed a test which might give these answers and help prevent miscarriage. I'm Dr. Renee. I'm a practicing doctor, a medical writer and a broadcaster. UK scientists have revealed a new test which they say can help identify women with an abnormal womb lining that increases their risk of miscarriage. This could pave the way for new treatments for those going through the trauma and heartbreak of repeated pregnancy loss. For some women, the womb lining just doesn't react in the way that it should, and without this critical reaction, a pregnancy cannot last. This breakthrough could provide an explanation in some cases for the trauma and devastation of recurrent miscarriage. Miscarriage is common, with 1 in 6 pregnancies affected and 1 in 4 for older women. Most previous research has focused on embryo quality rather than the womb lining. New study with author Dr. Joe Mutter of Warwick Medical School has said, many women are told they've just had bad luck, but our findings show that the womb itself may be setting the stage for pregnancy loss even before conception takes place. The job of the womb lining is to receive the embryo and help it develop during pregnancy, thanks to a reaction which converts cells into a different supportive state. If that reaction doesn't fully happen as it's designed to, the risk of bleeding and early pregnancy rises. Once a woman has had one faulty reaction, she is more likely to have another, the researchers say. They have developed a new test which can measure signs of a healthy or defective reaction in the womb lining as it prepares to receive a pregnancy. The test is being piloted for more than 1,000 patients at Tommy's National Centre for Miscarriage Research at the University Hospital of Coventry and Warwickshire, that's UHCW. By analysing over 1,500 biopsies from more than 1,300 women, the research team found that an essential biological process called the decidual reaction, which prepares the womb lining for pregnancy each month, often doesn't properly progress in women with a history of miscarriage. The test takes a womb sample, and if the lining isn't proliferating as it should, a drug remedy has proven useful. That drug is sitagliptin, a commonly used diabetes drug, and it's taken for 3 to 4 months, and for many a successful pregnancy ensues. But this may also pave the way to find other treatments in the future. And Dr. Mutter says the next step is to use the test to assess potential drug treatments. Sitagliptin is usually used to treat diabetes, is currently the go-to option for womb lining issues, but there might be other existing drugs which can be repurposed. With 80% of drugs not tested on pregnant women, it's unclear which ones might be effective. Anyone can refer themselves to Tommy's clinic, but it does have a long wait list, and funding issues mean that patients must contribute to the cost of the test. But my experience of women's trauma in recurrent miscarriage is that this may be a small price to pay for a beautiful baby, and hopefully in the future it will be adopted into NHS care if it proves fruitful. So good luck all of you out there who are trying to get pregnant.